The crisis of opioid misuse, addiction, and overdose is devastating communities across the country. Over 100 Americans die of an opioid-associated overdose every day. It's happening in all demographics and populations.
With this national crisis reaching the terribly high level that it has, it was clear we needed to put this on an even faster and more aggressive pathway. And with the Congress agreeing and providing an additional $500 million a year, we have the resources to bring together all the best and brightest minds around the same table. The most exciting advances in science seem to happen when you bring people together from different disciplinary perspectives and you ask them to work as a team.
The HEAL Initiative is a transference of knowledge, and it's a collection of data. And when you have data and you have knowledge, you have the tools to change the future.
Bringing stakeholders to the table is essential to the success of these projects. I'm working with probation and parole officers and community health providers because us designing an intervention that doesn't meet their needs is not very meaningful.
The FDA has been looking at new alternative pain medicines that might be used instead of opioids. The HEAL Initiative is putting research and scholarly effort on this problem.
The HEAL Initiative is the best scientists, the best clinicians, the best policy advocates, but it also is committed to making sure we're hearing that voice of the patient and helping them understand they can direct their care and make sure we are all working in the same direction.
Through HEAL, we're considering what outcomes are important to patients as we carry out clinical studies, and then disseminating the information and overcoming some of the stigmas associated with the best treatments for opioid use disorder and best treatments for pain. To learn more about the NIH HEAL Initiative, its partnerships and research, and how you can get involved, go to heal.nih.gov.